Hey you, welcome back to my channel. My name is Lali. I make videos about nursing, the NCLEX, lifestyle, and health. If any of that interests you, you're more than welcome to smash that subscribe button. And today I want to go over the top 10 highest paying nursing careers. Yes, the top 10 in the United States. If you are a nurse, or if you are a student nurse, or if just nursing interests you in general, and you've been wondering how much are nurses actually getting paid, or how much can I get paid, or what's the highest I can actually get paid in a nursing career, you're in the right place. And if you are here, thank you so much for being here and watching this video. Stick till the end so you can get high quality content. And let's get started. Let's start with number 10. So I'm going to start from number 10, which it will be the lowest, highest paying nursing career, and to the top of the top of the top. So if you want to find out what's the top of the top of the top, stick around. All right, here we go. Number 10. Number 10 is registered nurse first assist. They make an annual salary of $96,518, and that's an average paid. So if they have experience, even more than that. So what exactly is a registered nurse first assist, right? A registered nurse first assistant, or RNFA, is a perioperative registered nurse that functions as a first assistant during surgical operations. Pretty cool, right? Let's see, what's the number 9 highest paying nursing career? Number 9 is family nurse practitioner. They make an annual salary of $98,408, and this is an average. What exactly is a family nurse practitioner? The position of family nurse practitioner, or FNP, is the career closest to functioning like a primary care physician. So you've seen them around. They're actually almost like, they're providers. They are very close to being basically a doctor, but they're not a doctor, obviously. They're a nurse, but they are nurse practitioners. So this one is a family nurse practitioner. So it's almost like working in internal medicine. They just work in general. They do a general patient care base, so which is pretty cool, and they're able to prescribe as well. So they get paid $98,408 per year. Pretty cool. Number 8. Let's see what's number 8. Number 8 is nursing administrator. Nursing administrator make an annual pay of $100,980 per year, or that equals to $48.55 an hour, which is pretty cool too, right? And what exactly is a nurse administrator? A nurse administrator, well, that one's easy, right? It's a nurse administrator. But let me just read it. A nursing administrator deals with the backstage operations of nursing, from budgeting and staff management to HR functions. So the nurse administration is the nursing director, right? So if you work, I work in a community health center, and I have my nursing director, and she is the nurse administrator. And at the hospital, they have the same thing. They'll have whomever will be like the lead nurse that is in charge of all the nurses, and they also are in charge of staffing and budgeting and things like that. But yeah, they get paid pretty good. But that's number 8, right? So what is number 7? Let's see. Number 7. Number 7 is pain management nurse. A pain management nurse makes an annual salary of $916 per year. That's the salary of a year. And what exactly is a pain management nurse? What do you think? They help with pain. They help manage a patient's pain post-surgery, or they work with patients who have chronic pain issues. So they are focused in anything that has to do with pain. So that is their focus. So that's pretty cool too, and pretty interesting, because it's so interesting to find out and know that there's so many things. Like, a lot of people become nurses and they're like, okay, I became a nurse and now what? Or I'm just gonna work in a clinic, I'm just gonna work at the hospital. But look at all these things. Like, you can become so many things. Nursing is so broad. Like, yes, it's one career, but you can't become whatever you want. There's so much. You can focus on whatever you want. If you like kids, focus on pediatrics. If you love internal medicine, focus on internal medicine. If you love surgeries, focus in OR. If you love, you know what I'm saying? Like, you can't just go beyond and beyond. And I'm sorry, I'm getting off topic. I'll get back to this, but I just thought, like, it's so interesting, right? Nursing is pretty amazing, guys. So that was number 7. Number 6, we're getting to the number 1. Let's see. Number 6 is neonatal intensive care nurses. And I am so blessed to had the best NICU nurses for my daughter when she had to stay at the hospital. They were so amazing, and I just feel like NICU nurses are a blessing to everyone out there, and I think that they should be, you know, I'm glad that they are in the top 10, because they should definitely be getting paid pretty good amount of money, because they do a great job and they're just so loving and so caring. So we love you guys. All right, so, and you guys are getting paid pretty okay too. They get paid an annual salary of $102,487 a year, and that equals to $54.75 an hour. And that is, they deserve it, you know, they deserve it. They are amazing. So, and neonatal intensive care nurses, they're the ones that care for babies. So cute. All right, number 5, certified nurse midwife, are nurses that are actually providers too. They can prescribe and they're providers. So they get paid an annual salary of $108,810 per year, or $52.31 an hour. For RNs who love obstetrics, labor and delivery, or prenatal care, becoming a certified nurse midwife is the perfect career path. And I actually worked with one, and she's amazing. She's so loving, and she is very caring, you know. Want to choose that career, and it's, you know, a lot of people like nursing and they want to do OBGYN. I work in an OBGYN office, and that's been my job for like 4 years now. Even though now I am the nurse manager for pediatrics and the OBGYN department, OBGYN has been in my life for so long that I'm very focused in it too, and I have learned so much from it. So I think that it's a really cool career, and you learn so much, and you just see so many things and so many babies. So it's really cool. But yeah, they get paid really good, and like I said, they are not just a nurse, they are actually providers. So I'm not sure if this is something I would want to do, but hey, if you do like OBGYN, if you're a nurse and you want to further your career, why not? Number 4. Now getting closer to the countdown, like the actual countdown. Number 4. Number 4 is a psychiatric nurse practitioner. And all of these now, this one is also a provider. They are able to prescribe. And when I say provider, is that, you know, they're able to prescribe, and they basically function as a doctor kind of thing. Psychiatric nurse practitioner make an annual salary of $105,658,000. Oh, but wait, that one makes less than the other one, right? They kind of messed up on this one. So I would say that's number 5, and number 5 is number 4, because they get paid $105,658 $100,000, and the nurse midwife make 108. So that was a little backward there, but they get paid pretty good too, right? And psychiatric nurses, as its name says, they work with psychiatric patients. It says for nurses with an interest in mental health, working as a psychiatric nurse practitioner will give you the opportunity to work with psychiatric medical physicians and consult patients regarding mental health disorders. And these nurses are great too, because mental health is so important. Like, you see so many issues and so many things that go wrong due to mental health issues that are not being addressed. And making sure that these mental health issues are addressed and cared for is very important. Getting closer, guys. Number three is a clinical nurse specialist. Make an annual salary of $106,028. Clinical nurse. What exactly is a clinical nurse specialist? I don't know. Let me find out, because I really don't know. Those who wish to work in a specialized unit or clinic should consider the clinical nurse specialist path. In addition to diagnosing and treating various conditions, you'll be looked upon as an expert within your healthcare team. Clinical nurse specialists focus on improving the status of nursing at the hospital. They are involved in research and bettering the care provided in the healthcare setting. That's pretty cool. These are nurses that want things to be better, basically. And number two, número dos. Which one is number two? Number two is the general nurse practitioner. General nurse practitioner. And guys, like I said, this is just an average salary. If you have experience, they even get paid more than that. So it's a general NP. You can choose to open an independent practice or work in a variety of primary care settings. You can also advance your skills and your earnings potential along the way. General NPs can later specialize in a field if they wish. That's pretty cool. I like this one. This is something I'll be kind of like interested in. They get paid $111,840. Guys, we made it down to the count. We made it to the top of the countdown. And if you know what number one is, hit the like button and write a comment and say, I think number one is this. I'll give you a chance to do that before I tell you. I don't want to spoil the surprise. Go ahead. Write a comment below and say what you think is number one. Let's see. Number one is certified registered nurse anesthetics. I'm sorry, guys. My accent always gets in the way of things. I'm trying to say the word right, but I'm not sure if I'm saying it right. Certified registered nurse anesthesiologist. I'm going to say anesthesiologist because anesthetics. Am I saying it right? Anesthetist. No, anesthetics. His son likes it if you like my accent. Certified registered nurse anesthetist. I think that's the best I can get. It's a CRNA. That's easier for me to say. They earn, this is a pretty darn good pay, guys. And this is just an average. $181,040. That's pretty darn good. $87.04 an hour. CRNA earn significantly more than any other type of nurse or nursing specialty. This highly skilled profession involves preparing and administering anesthesia to patients in collaboration with surgeons, anesthesiologists, dentists, podiatrists, and other qualified healthcare professions. Working with anesthesia, it's very important. You have to make sure that you're giving the right dose to the right patient, that the patient, based on their weight, based on, like, you have to base it on so much, and it's so risky, and you have to be very, like, open-minded. You have to be very careful with everything. If you notice that another nurse didn't do something right, they didn't place the IV line right, or anything like that, you have to be very vigilant, and, like, really, like, I don't know, have, like, your mind needs to be completely clear and open if you decide to become a CRNA, because people's lives are truly in your hands. You know what I'm saying? Like that, which, like I said, the pay is great, it's amazing, but at the same time you have to think about all the risk, you know. So this is something that I at one point was interested in, but I think about these things and sometimes I get a little scared. So I'm like, oh my gosh, like, people's lives are in my hands, and if I were to do something wrong, like one little thing, maybe one little drop of an extra amount of the anesthesia can kill this person. So you have to be very open-minded and very careful with everything that you do. But if you decide to become a CRNA, good for you. That it's an amazing choice. You'll be getting paid really good money, and I also hope that you are, like I'm saying, open-minded, and that you are really thinking about the patients, not just the money. Okay, but pretty darn good pay, I tell you that for a fact. All right, guys, so we made it down to the top number 1 highest paying nurse profession in the United States. If you like this video, please give me some thumbs up, and I hope you are subscribed to my channel, because if you're not, what are you waiting for? Subscribe to my channel, and like I said, I make videos about nursing, the NCLEX, a little bit of lifestyle and health as well. So you'll be seeing my face a little bit more around, and hopefully next time you see my face, I have some makeup on, and I'll have my contacts, and I'll be looking nicer for you guys, because it's been a struggle, guys. Like, I don't even know how I'm doing, how I'm living, because it's insane. I am overwhelmed, and I do too much, and I want to do everything, and I need to stop that. So yes, I need to stop that. But anyways, I'm here, guys. I'm here making this video for you guys, and I hope you enjoyed it. I hope that you got some good content out of it and some good information. So, and I will definitely see you on my next video. If you want to keep watching some more of my videos, you can click on the screen. Thanks for watching. I'll see you next time. Bye.